everyone, and a warm welcome to today's episode of our podcast series. I'm your host, Hedvisha, and I am thrilled to have join us today. We're delving into a topic in dermatology, which is dermatology in aging and strategies for managing skin in older adults. As our population ages, understanding how to care for aging skin becomes increasingly important for healthcare professionals. And I'm excited to introduce to our today's guest, Dr. San Kyi, a dedicated general practitioner specializing in dermatology based in Myanmar. Dr. Kai has a profound commitment to skin health and wellness, continually updating her knowledge and dermatological advancements to provide the best possible care for her patients. Her holistic approach not only treats skin conditions but also emphasizes prevention and education, empowering her patients to make informed decisions about their dermatological health. And today, Doctor will be presenting a PowerPoint that covers key aspects of aging skin and strategies for effective management. So, thank you, Doctor, for joining us, and over to you.
Thanks for the kind introduction. It's a pleasure to be here today to discuss an important and timely important regarding the aging and dermatology strategies for managing skin in the older adults. Major age-related dermatological changes include xerosis, dry skin, wrinkling, laxity, dermal thinning, and various benign neoplasms. Skin becomes inelastic and recovers more slowly after injury due to gradual physiological decline termed intrinsic skin aging. As we age, the skin function decline, such as barrier function, cell replacement, DNA repair, epidermal hydration, immune responsiveness, sebum and sweat production, sensory perception, thermoregulation, vitamin D production, and wound healing. Another important factor is the extrinsic agent, sun exposure and smoking, adding to the intrinsic agent, worsen the wrinkling, laxity, and dermal thinning and dryness. While many changes to the skin are normal as people age, certain signs may warrant further investigation to rule out underlying conditions such as skin cancer, infections, inflammatory diseases. So, we should understand our normal aging signs like thinning of the skin as people age, dermis become thinner, leading to more fragile skin that bruise as easily. This is generally symmetrical and affects area exposed to the sun. And there is dryness, reduction in the ceramide production and the stratum corneum and oil glands, less active, causing the dryness, scaling, and becomes itching, especially in the winter or in dry climates. Fine lines, wrinkles, loss of elasticity, and sagging are caused by loss of collagen and elastin, as well as decreased subcutaneous fat, typically pronounced in the sun-exposed areas like the face, neck, and hands. There's also sagging around the eye, mouth, and jawline. Healthcare professionals should become vigilant when early skin changes raise concern. Any alteration in existing mole or newly developed mole, such as color variation and increase in size, asymmetry, or symptomatic like itching, bleeding, or pain, even if it is small. So we need to pay close attention and possible further examination. Non-healing sores or scaly or crusty patches, particularly on the sun-exposed sites, are concerning signs of the skin cancer, such as the basal cell carcinoma and squamous cell carcinoma. Changes occur in a pre-existing lesion or a precancerous lesion, actinic keratosis, such as rapid growth, change in color, or become symptomatic, especially in the fair skin, male gender, with the feature of solar elastosis. And if there is chronic non-healing ulcers, particularly on the legs, may indicate the vascular insufficiency or diabetes and other vascular issues. So regarding the normal aging signs, there is pigmentary changes, age spots, solar lentigines, which are flat brown spots on the sun-exposed areas are benign but common in older adults. And there's also benign growths, seborrheic keratosis, benign waxy wart-like growths that can appear anywhere on your body. These are common. And there's also cherry angioma, small red or purple benign vascular lesions. Maybe there are more serious dermatological conditions. If there is profound and persistent itching in the lower extremities, but may also be generalized. Scratching and cirrhosis may be associated with a systemic disease like diabetes, renal failure, thyroid disease, or hepatic conditions, or very rarely cutaneous T-cell lymphoma. If the itchiness is persistent, more intense during the nighttime, involving the acral site, especially in the nursing home people, who should be cautious whether there is scabies infection involved. Dermatologists must evaluate how do advanced therapies compare effectiveness and safety in older adults with fragile and sensitive skin. Advanced therapies should be compared how efficacy and safety when treatment in the older adults with sensitive and fragile skin. For example, ablative lasers are highly effective for the pigmentation, wrinkles, and skin tightening, but for the safety concerns, non-ablative lasers are generally safer and quicker recovery time. So we should be careful. Benefits should clearly outweigh the risks and burdens. So for the efficacy concerns, we will assess any changes in the clinical signs and symptoms of the disease or prevention of the flare. And for safety outcomes, any serious adverse events, any withdrawal events due to the adverse events, and any infection. Before advanced therapies, next, individual comprehensive consultation, skin examination, we shall do the skin condition and thickness and healing capacity. Older adults having dermatological thinning skin, bruises, secondary risk factor, chronic adrenal damage, genetic susceptibility, and long-term use of systemic and corticosteroids. When making treatment modalities, we shall adjust accordingly, such as using lower intensities of the lasers or superficial treatments for lasers, avoiding aggressive therapies. So we shall emphasize on the individual drugs again or device, their side effects, safety profile, and therapeutic margin of the skin. And any drug interaction, pre-existing medication such as immunosuppressants and corticosteroids. The patient goals and expectations. More advanced therapies shall be made using shared decision-making by pre-treatment counseling, clinicians taking into account the severity of the disease and the efficacy, safety, and accessibility of the interventions, the advanced interventions, and its impact on the patient. And we should discuss course and frequency of the treatment, and a good prescribing practice may limit the adverse effect and inappropriate prescription. And we also showed ongoing evaluation and monitoring of the older adults' medication profile. And we should also counsel clear communication of the medication information to the patient, family members, caregivers, and for the next healthcare professional. And we should also show limitation in the number of prescribers, regular medication review, and new prescribing checklists, and will improve the prescribing of the elderly. So, by carefully considering these factors, dermatologists can select the most appropriate and safe advanced treatments for their older patients with sensitive or fragile skin, ensuring both efficacy and safety. Sun protection is crucial. Importance of the sun protection evolve as we get older. Over a lifetime, exposure to UV rays causes cumulative skin damage. This leads to premature aging, wrinkles, age spots, and loss of elasticity, photoaging. Sunlight is composed of infrared, visible, and UV lights. UVB only penetrate into the epidermis and apodermis and cause direct DNA damage, inflammation, and immunosuppression. UVA penetrate the skin down to the lower dermis, so UVA is larger contributor to the skin aging than UVB. UV damage impacts the collagen degradation and synthesis. Visible light generates reactive oxygen species in human skin and induces the formation of oxidation species. Infrared A can reach down to the hypodermic and increase the reactive oxygen species production and disrupt the mitochondrial integrity. As we get older, skin becomes thinner, more fragile, making it less able to repair itself after sun damage. This increases the risk of sunburn, bruising, and tearing. Sun exposure significantly increases the risk of skin cancer, especially basal cell carcinoma, squamous cell carcinoma, and melanoma. The longer the lifetime exposure, the higher the risk in older adults. So, using high protection sun better, broad spectrum sunscreen with UVA and UVB, especially SPF 30 plus and higher, are appropriate, and there should also be appropriate clothing. And avoiding the peak sun hours can help prevent further photoaging and skin cancer, especially for the Fitzpatrick skin type 1 to type 3 and those who mostly work outdoor and those genetically prone to get sunburn and damage. It's also to be cautious if taking photosensitizing medication such as diuretics, hydrochlorothiazide, and cardiovascular drugs such as imidazole. Many older patients are on multiple medications. Adverse drug effects are higher in older adults due to metabolic changes and decreased drug clearance with age. Polypharmacy may increase and decrease and cancel the effects of different drugs due to the drug interactions and medication error. Long-term corticosteroids, systemic and topical, for treating inflammatory diseases and autoimmune condition has made severe skin atrophy, appearance of striae, and decreasing the immunity, prone to infection like the herpes zoster, bony fracture, and easy bruising and delay wound healing. Diuretics, removing fluid from the body, may cause electrolytes imbalance and dehydration and dry skin. Thiazide diuretics and some cardiovascular drugs such as amiodarone may cause persistence of photosensitivity and evolution to chronic actinic dermatitis like pruritus, lichenification, and excoriation on the sun-exposed sites. Anticoagulants may cause GI bleeding. Warfarin or newer drugs like episaben reduce the blood clotting, making skin prone to bruising, bleeding, and hematoma. Wounds and cuts may heal more slowly. So, we have strategies can be implemented to mitigate their dermatological side effects, such as skin thinning or delay wound healing, like moisturization. With the thick emollient-rich moisturizers regularly to help maintain skin moisture, hydration, and barrier function. Opt for products containing ingredients like hyaluronic acid, niacinamide, glycerin, and ceramides. And we can also use gentle cleansing, use mild non-irritating cleansers to avoid stripping skin barrier function and avoiding the harsh soaps and antibacterial washes that can exacerbate dryness. We also use sun protection, encourage regular sunscreen application to prevent UV-related skin damage, which can exacerbate the thinning of the skin and dryness. We also should have nutritional support, ensure a balanced diet rich in vitamins and minerals that support skin health, such as vitamin A, vitamin C, vitamin E, and zinc, and as well omega-3 fatty acid to support. We can also use the retinoid, the topical one, which smoothen the skin and reduce the fine lines, wrinkles, and increase the production of the collagen and reduce the unevenness of the skin. It is also an anti-aging. For older adults, physical activity regularly improves the skin as well as the body build and collagen and preventing the skin thinning. We should also avoid inappropriate use of stronger topical steroids and use of the systemic steroids. In older adults, we can better assess and manage actinic keratosis, basal cell carcinoma, and squamous cell carcinoma using the protocols we shall follow, such as we carefully combination of the patient history, visual examination, and using the diagnostic tools. With the patient history risk assessment, we can assess for the risk of skin cancer about the personal and family history of the skin cancer, sunburns, tannin bed use, and any immunosuppressive conditions. And we also inquire symptoms, ask about changes in moles or lesions, such as growth, bleeding, and pain. We should do the full body examination, a complete skin exam from head to toe, scalp, ears, genitalia, and between the fingers and toes. That lesions that is standing out of the other lesions or suspicious looking. We will use the ABCDE criteria: asymmetry, border irregularity, color variation, diameter larger than 6 millimeters, evolving changes in size, shape, and color. We can also use diagnostic tools using a dermatoscope to magnify and better examine suspicious lesions such as mole and suspicious mole. Dermatoscope help to differentiate benign from malignant lesions and reduces the need for the unnecessary biopsies. We can use the biopsy of the suspicious lesions, excisional biopsy for the highly suspicious lesions, such as where the entire lesion is removed for histological examination, and incisional or punch biopsy for the larger lesions or those in the sensitive areas. A sample may be taken for analysis. We can also do the molecular and genetic testing, gene expression profiling. In some cases, dermatologists may recommend molecular testing for gene mutations or other markers that can predict the likelihood of being malignant. And we should follow up and monitor regular skin checks for high-risk patients, for those with a history of the skin cancer or numerous atypical moles. If they have numerous atypical moles, we should more frequent screenings every 3 to 6 months. We should encourage them some protection, self-examination, and regular skin checkup. If necessary, we should refer to the oncology surgeon and for the advanced diagnosis, if confirmed malignant and invasive, or concern for metastasis, for further evaluation and treatment. We should do genetic counseling for those strong family history of melanoma or other hereditary cancer syndromes. This systemic approach ensures that dermatologists provide thorough screening and early detection, which is critical for improving outcomes in skin cancer patients. Healthcare professionals. When healthcare providers counsel older patients about nutritional interventions like antioxidants, omega-3 fatty acids, and collagen supplementation, they should focus on evidence-based guidance considering the individual needs and health status of the patient. Here's an approach to providing balanced and effective counseling. These nutrients and their role in supporting skin barrier function and skin elasticity. Number one, assess overall health and nutritional status. Comprehensive assessment evaluate the patient's overall health, current medications, diet, and any underlying conditions that might influence their nutritional needs, cardiovascular disease, diabetes, or autoimmune disorder, and any risk of deficiencies due to factors like reduced appetite, malabsorption, or chronic conditions, making supplementation more relevant for some patients. And we should also provide evidence-based information, antioxidants, vitamin C, vitamin E, beta-carotene for their skin benefits. They reduce oxidative stress caused by smoking and pollution and sun exposure, which accelerates the skin aging. Vitamin C in particular is crucial for collagen, and while the vitamin E helps protect skin barrier from damage. We should emphasize that a diet rich in fruits and vegetables, a natural source of antioxidants, beneficial and safer than relying solely on the supplements. Supplementation may be necessary if the dietary intake is insufficient. We should be cautious High-dose antioxidant supplements can interfere with the certain medications like blood thinners. Omega-3 fatty acid from fish oil can reduce inflammation, support the skin barrier, and help retain moisture and reducing dry, flaky skin. Encourage consumption of the fatty fish like salmon, mackerel, flax seeds, and walnuts. Supplements from whom do not consume enough omega-3 through their diet. Collagen supplementation helps maintain skin elasticity and hydration and reduce wrinkles, may not produce dramatic changes, maintaining overall protein intake through diet, lean meat, fish, eggs, legumes are essential. Some prefer plant-based options, collagen building like vitamin C. We also encourage a balanced diet, whole foods first, importance of well-rounded nutrient-dense diet over relying on the supplements. Focus on colorful fruits and vegetables for antioxidants, lean proteins and healthy fats from nuts, seeds, and fish for collagen synthesis and skin barrier function, and proper hydration for maintaining skin moisture and elasticity. We should tailor recommendations to the patients. Some patients may already be taking multiple supplements or medications, taking into account the drug interactions or contraindications with their existing medications or health conditions. If the patients express concerns about dry, thinning, or wrinkled skin, recommend appropriate treatment. And we should provide realistic expectations. Manage their expectations while nutritional interventions supporting skin health may not reverse immediate or may not reverse profile their aging. It also depends on their genetics, sun exposure, overall lifestyle may play a large role. So we should provide the long-term commitment. Benefits from dietary changes or supplementation may take time. So consistency is the key. We should monitor and follow up with the patients regularly to assess their response, ensuring not experiencing any adverse effects and adjusting as needed. Periodically review whether continued supplementation is necessary based on patient's health status and any improvement. We also consider contraindications and safety, avoid oversupplementation as taking high doses, vitamin E toxicity, omega-3 overdose leading to bleeding risks. Encourage patients to consult with healthcare professionals before starting new supplements, especially if they have existing health conditions. By providing thoughtful, individualized counseling, healthcare providers can help older adults make informed decisions about the nutritional interventions that support their skin health and overall well-being. In conclusion, while aging is a natural process, understanding of it affects the skin is essential for both maintaining and healthy skin and detection of the potential concerns early. By being vigilant and aware, we can help our patients age gracefully while also safeguarding them from more serious skin conditions. Thank you for your attention.
Thank you so much, Doctor, for sharing your valuable insights with us and with this enlightening presentation. And on that note, I just have a few questions and then we can end. So you mentioned about the importance of differentiating between normal aging and more serious dermatological conditions. So can you elaborate on how actually doctors can recognize better these early conditions?
The normal skin is usually there are fine lines, wrinkles only, thin dermaplanin, laxity, and there is uh, le- but the skin is becoming drier and and maybe easily bruised. But you mean that you mean that if it is becoming abnormal,
Yes.
like the roses is more drier uh, in particular place or in the over the sun exposed side. If it is maybe due to the external factor, it may include the external factor like sun exposure, smoking, or or maybe genetic, or maybe uh, underlying systemic illness, or maybe he may take some skin thinning drugs like the uh, corticosteroids or other immune changing drugs. So we have to examine thoroughly whole body, and we have to ask the questions, and if necessary, we have to investigate with the with the blood investigation or other advanced investigation.
Yeah.
And if some area like changes, if some area like changes, some area is more dry, like the lower legs, or maybe there might be some stasis dermatitis. Maybe he scratched persistently. May he get the stasis dermatitis, or he may have underlying like the varicose vein association. So he might have something different from the normal cirrhosis, normal dryness. Yeah, and
Yes.
if the dryness is uh, if the scratching and itchiness is maybe due to the uh, maybe simple dryness or something different, we have to consider other rare conditions. If he is persistently itching, we have to consider different things, or rarely he might have other rare condition like the cutaneous malignancy or something like that.
Hello.
So we should consult her uh, regarding the wrinkling, or if
Okay.
there is appearance of the new mole, or changing at the rapid changing at the pre-existing mole, rapid growth, or change in color variation, and asymmetry. We should be cautious. We should investigate, like the using the dermatoscope, like the diagnostic tool, or maybe we biopsy, yeah, and send
Yes.
to the laboratory.
Okay, got it. Understood. Thank you for that explanation. So now, you also mentioned about the importance of sunscreen and sun protections. So can you discuss how do you advise your patients about adjusting their sun protection strategies as they age?
Yeah, sunscreen, they should use the broad spectrum sunscreen, both UVA and for the UVA and UVB, at least SPF 30 plus and higher. And at least they should apply 30 minutes before going out. And they should apply using at least uh, uh, 1 ounce, like 2 tablespoon for the face as well as for whole body. And if they are going outdoor and they are staying in the sun, they should reapply it every 2 hours. And if they go swimming, they should apply the sunscreen immediately after coming out from the pond, or after finishing the swimming. And they should also wear the appropriate clothing, white brim hat, or yeah, they should not go during the peak hours. If they are very, sometimes most for the skin type, Fitzpatrick skin type 1 to type 3 is more sensitive. So so they should not go outside during the peak hours.
Yes, makes sense. That is very good advice as well, doctor. Now, as we wrap up today's
Thank you.
discussion, I would like to thank you and extend my heartfelt thank you to doctor for joining us and sharing your invaluable insights and knowledge on dermatology and aging. So, thank you so much, doctor.
It's my pleasure.
Thank you. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay aware and take care of your health.